Welcome to All Things Chiropractic.
Well, welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
Hey, welcome. I'm Dr. Mark Davini.
So today we're going to talk about something that's been out there. If you're in the chiropractic world, you're not living under a rock 100% of the time. You're on social media. You've probably heard, hopefully, of HR 539. This is a Chiropractic Medicare Coverage Modernization Act that was filed in 2025.
It's interesting, that it has taken all this time to finally take a look at the fact that we have this ridiculous type of coverage for seniors under our federal program like Medicare.
Yeah, so let's start with a little backdrop or background to get everyone up to speed. It's probably very well known, hopefully, that in the Medicare Part B system with chiropractic physicians, the only service that potentially is reimbursed is the spinal manipulation. That's it. 3 codes. Boom. Done.
Not only that, we are literally a profession that cannot opt out of Medicare. So you can't quit. My favorite thing to say is it's the Hotel California of healthcare. You can check out anytime you want, but you can never leave. I know nobody gets it, but it's too old.
Well, I don't know what you're talking about. I have no idea what you're
The Eagles, come on. Eagles.
Those are raptors, birds of prey, right? Don't they
Yeah.
fly around? Yeah. Okay. Anyway, so since the inception of this coverage in chiropractic, we've battled as a profession. Well, even as an education company, we were just at Texas Chiropractic College teaching Medicare at their conference. And we won't get into the Medicare Part C or Advantage plan discussion because that's a whole absurd discussion. But we're talking about original Medicare now, right? And, we spent, probably 7 out of the 8 hours just talking about navigating Medicare from documentation, medical necessity, ABNs, good faith estimates, coverage, modifiers, billing, diagnosis.
In Texas, you're required to take at least 8 hours of Medicare once within the first few years of licensure. And I got to tell you, we filled up 8 hours of stuff that's Medicare.
And so in the backdrop discussion, obviously, we're talking about the fact that Medicare only covers the spinal manipulation, yet they do require you to demonstrate subluxation by an exam and or x-rays, of which they will not cover.
Yeah. It used to be worse back in the day when they only allowed 12 visits a year, but they required you to take new x-rays on your senior patients every year, but they wouldn't pay for them. You were required to take
and funny, in our jurisdiction, there was 12, 24, 36, 48, or 60 visits on average based on your diagnosis. And there were 2 diagnoses that had 60 visits. And I swear they were just like, hey, come audit me diagnosis.
Yeah. That's what
unrelenting pain was one of the diagnoses.
Yeah, please audit me. So they've, in a sense, they've simplified it, but they didn't modernize it. They simplified it by basically saying, we don't care about all that other stuff anymore. You have unlimited coverage and it's just for these 3 services, 98940, 1 and 2, period. So it is well past the time that this needs to be changed and well past the time that we need to rally everybody. So this podcast is really in sync with everybody else across the country that is putting out the call to chiropractors to handle this. You can't sit back. Whether you feel Medicare is your type of practice or not, it doesn't matter. The fact that we are different in the Medicare world has to go away. So this is a rally cry. This is a call to action.
I feel like that Braveheart, movie.
That's right.
You should have come with the painted face like Braveheart. Exactly. That would have. Can I overlay that? Let's see if I can edit that. So before we get to the how you can help, let's get into what are the changes with this bill that was filed in 2025, which has a lot of bipartisan support in the U.S. Congress, which is great, and the Senate. So,
Yeah. And recognize too that whatever is proposed can end up in a different form if it ever
oh yeah.
gets that far. So what we're saying today may actually be different if it gets to that end. But let's dream. Let's dream about what we're getting here.
So broad strokes, nothing changes as far as the coverage for the spinal manipulation to correct subluxation of the spine. But the big difference here is that your Medicare would expand reimbursement to any service that's within your scope of practice in the state in which you practice.
Wow.
How cool is that?
Yeah.
Do you remember the demonstration project? You're way older than me. So you know,
I remember it because
yeah.
I think you told me about it way
Yeah.
back.
Yeah, sure. If anyone was around during the demonstration project, there were areas of the country that they did this, sort of test pilot program where they paid chiropractors for everything they did. And back then, if you were in that jurisdiction, it was great. You had this little windfall of Medicare reimbursement for exams, X-rays, therapies, modalities. What wasn't so great was after the 2-year demonstration project ended and they crunched the data, the amount of fraud was extremely shocking. So,
There's the rub, right?
you know,
You know, give us
really
more
didn't help,
freedom, give us more
you know?
chance to abuse it, right?
I'm not gonna say where in the country they did this, but they chose areas that really tested, you know, honesty.
Right. So here's the warning. Careful what you ask for in 2 ways, right? Number 1, if it's another source of abuse, because we know that there's actually a widespread amount of abuse of Medicare in the chiropractic profession. We the statistics that support that, so we have to be very, very careful that if they give us this, which we all hope and pray for, right? If they give us this, then we have to be mindful that we have a responsibility to use it responsibly.
Exactly, and so talking about this bill, which is so on our website, allthingschiropractic.com, you'll see a couple of buttons. One is to govtrack.us, and that shows you where this bill is, what is the actual text of the bill. It's a very short bill, actually. There's not a lot
Yeah.
there that they needed to put in there. Again, this is the current version. It could and would likely change in some ways, but you can see it all there. And then we'll talk at the end about the other link that we have on allthingschiropractic.com about how you can get yourself and your patients engaged in the support of this. So, what's interesting, I think, Doc, about this is one, the very short, brief language of this bill. It's very short, but in the section under coverage limits, it includes a provision that if you're going to do anything beyond the chiropractic adjustment, you have to take this one-time webinar from HHS about documentation.
So here we go, right? We're back to what you and I talk about over and over and over again is documentation. And when I said earlier that there's a widespread fraud in the Medicare system from chiropractors, that's their interpretation. The interpretation is it's fraud because we are not documenting what we do well enough to prove otherwise. So, th- with great power comes great responsibility. And that's what they're giving us
Yeah.
here. Yeah, that's
So
what they give us here. So we have to step up and do what obviously always leads back to the same old thing, documentation.
and I'll put it to you this way. If you out there, doc, listening, think that documentation isn't that important or it's kind of a throwaway, yeah, I do it because I have to. The expansion of Medicare coverage for chiropractic documentation is so important to those the powers that be that they wrote it into the actual statute. It's in the bill.
Yeah, it's in the bill. Think about it this way. They grant this bill, they pass this bill. And then all of a sudden, millions and millions and millions and millions and millions of Medicare people will now be going to their chiropractor, getting exams, getting x-rays, getting therapies, or whatever it is that's allowed in the bill. And now all of a sudden, Medicare is going to be getting these huge bills coming from our profession. I mean, tens of millions, if not hundreds of millions of dollars more than what they're getting now. So the line item under chiropractic and Medicare services is going to skyrocket. So if when we get this bill, we will be under a greater scrutiny, which means documentation, documentation, documentation. We can't just look at this as a free ride. Oh, great. I get to charge for exams. Now I get to charge for x-rays and therapies and all of the stuff I do in my office. And so you just do it and there's no documentation justifying it. The one thing we could probably take a fair guess at, Paul, is that Medicare is going to spend a little bit of time up front checking us.
Well, one could surmise very easily a couple of things. As you say, the amount of scrutiny or post-payment audits and even prepayment audits will likely go up because the MAC carrier has a responsibility to CMS to ensure that they're making payment correctly. So there's definitely that. Now, on the cost side of things, presumably and most likely, I'm going to assume that other specialties or provider claims will go down based on the usage of chiropractic going up. One would hope that with more chiropractic care, less need for other medical services because the chiropractic care is helping to handle those issues. Wouldn't you think that, Doc? I mean,
You would, but unfortunately, the way budgeting occurs in these federal and state programs, we're a line item and they're a line item. The two line items never mix. So if our line item goes up and another line item, like say low back surgeries, go down, they're not going to make the link. That's not what they do. They look at it as a single line item that has gone up. So we will be held accountable for the fact that our line item in the Medicare budget has gone up. They won't give us the credit that other line items have gone down. Maybe somewhere down the road, someone will do that kind of analysis. But for the most part, it's just going to look like a line item that has increased dramatically, which is okay. That's the way it should be. We deserve to have these services covered. Patients deserve to have these services covered. We provide something that can't be found in any other branch of medicine, but we're not going to get the credit for making other line items in the in the Medicare budget go down. We're only going to get credited with our line item going up. So we have that responsibility to make sure that they made the right choice.
and that's
We
why we
can't.
have advocacy, right? That's why the ACA, ICA,
Right.
your straight trade associations in your states, Cairo Congress. This is part of what we would assume that they would help contribute to is looking at that data outside of budget line items to
Yeah.
say, hey, there seems to be an inverse relationship here. Yes, our reimbursement went up in chiropractic, but look at the surgeries, neuro, PT that all came
And our
down.
responsibility as an educational company is to make sure that you do know what you're supposed to do and how you're supposed to do it in the documentation world, because there will be scrutiny, there will be audits, there will be reviews, and we want to show them that we took it up, took the responsibility, claimed what is ours, what should have been ours from the beginning, and that we're doing it right. So there's a double call here. Get the bill passed and then accept all the responsibility that comes with that bill being passed. Oh, what are you laughing
And
at?
what, well, because, according to the data, we have nowhere to go but up because the error rate for chiropractic was like 100%, right? So
100%.
even if we do just a little bit better, we're going to show improvements.
Right. And most of what made it 100% might be considered trivial matters, but
Yeah.
they're mostly documentation. When we give our class, what do? What are the reasons why claims failed? Because you failed to document this and document that and document this and document that. So we're looking toward the future of saying, wow, chiropractic, Medicare, which basically we all accept that the society is graying, that there is a huge increase in the number of Medicare patients. Whether you personally want to accept Medicare or not is one thing, but we have to accept the fact that a large percentage of the population is going to be Medicare. And if you eliminate that from your practice, that's your choice and a business decision, but recognize that you are basically saying no to a large number of people.
That's why I look at this and say this is great that there's some traction that, we need a lot of grassroots to push this along because what you're fighting alongside politics, obviously, and alongside some probably continued bias from the medical field, what we're fighting is the fact that the cost is going to increase, and the OMB, I'm sure, is well aware of what those costs will likely be. So
Mhm.
we have to fight that back with grassroots,
Yeah.
right?
You can't use common sense on this one. It's logical that we should be covered for services that we provide that are necessary services, that are actually services they mandate we do, but they
Right.
won't cover. They require the patient to pay it. So that's common sense. But we, again, what you just said, we have to look at the politics of it. And when politics of it really just backs up to mean the cost of it. So we will be increasing costs on our line item. And that means we have to take the responsibility of justifying that cost. And or here's the other thing that we get to do that we can't do now is opt out of Medicare. In its current form, we would be able to opt out of Medicare, something that chiropractors can't do. So all around, it's a great bill. All around, it's good for the profession, and all around, it could mean a change in how we do things in the future when it comes to the senior population. And also, it reinforces everything we've ever said about the responsibilities that are necessary to make it work.
Okay. Not to be cynical, but I'm going to go ahead and just put it out there. Be careful what you wish for, in a sense, because with this potential expanded reimbursement based on your scope, if the documentation and claims reporting goes the way of physical therapy, it's going to be a tremendous burden on the chiropractor and the office to have to deal with percentages of improvement, modifiers that represent that, initial thresholds of maximum dollar amounts, and then additional modifiers that get you in even additional trouble
Oh,
if you're not meeting the documentation standards of additional care. I mean, yes, physical therapists get paid a lot more currently than chiropractors do in Medicare, and they have a lot more responsibility of reporting and documentation.
you can't even compare what we
No,
do in the documentation world to what they have to do, and yet we're the ones who complain the most about it. Every physical therapist I know, when we talk about it, will say, "Yeah, it's a pain in the butt." But you have to do it, and they do it. It's this extensive narratives of everything that's going on in their office. So, yes, there will be that type of situation. Also, the other thing too is likely it will follow the same formulas that they give us for reimbursement, which means, all great exams and X-rays are covered, but probably not at a full rate that you're hoping for. The rate's gonna be based on what their thinking is, similar to the spinal adjustments, and it's gonna be probably a significantly lower rate than what you're used to charging for and collecting for now.
there is that. It's based on RBRVUs with a Medicare, professional fee schedule. It will always be less than you want,
Right, right.
and maybe even less than you charge for an uncovered service right now out of pocket,
Mm,
but it is what it is. We'll see what happens as time progresses.
mm,
What we have now that we didn't have in the past is the um, love it or hate it, the integration of AI tools in our EHR, so that a lot of these physical therapy EHRs integrated into them are these compliance checks. You see a little bit of it in Cairo
mhm.
too. They have these compliance checks and coding assistant where if you don't document and show certain things in the soap note side of things as a PT, it won't code out the right modifiers to get paid because it's not seeing you back it up with documentation, which is great. I think that's a nice
Yeah.
check. It's kinda cool. I'm sure chiropractic EHR will fill in quickly when this happens and this passes,
Right.
you know?
So, yeah, here we are, again on the precipice of something great. And so before it happens, and it will happen, right? Let's think positively. Before it happens, accept the fact that it will change what you do. And if this is a change you don't want, again, part of what's coming through here is the ability to say, no, I don't want to do it, which we technically don't have that ability right now. So let's all think positively that number one, we're going to get something that we should have had from day one. Number two, we're going to be offered choices that we don't have presently. And number three, we have an opportunity to expand our practices to a population that has had challenges at sometimes maybe finding their ways into our office.
So, that goes to the call to action, and on our website that's right, yeah, there's the Braveheart theme running on
Yeah.
allthingschiropractic.com. You'll when you go to the homepage there, if you scroll down past the player with all our episodes, you will see a couple of buttons. The first one is our federal bill HR 539, Chiropractic Medicine Coverage Modernization Act. That link will take you to the Gov track where you can see the actual language. It's not very long, so it's easy to read. You can see where it is, and you can track along the way where it continues to be in the legislative cycle, if and when it comes out of committees. And then the other button is the use voter voice to send a message to your US senator and US rep. It's very easy. When you click on that button, it'll take you right to the voter voice where it has you put in your address, it will pre-populate who your senator and representative is. There is
It's
some
really very sweet. Carol Congress did a nice job putting this page together.
yeah, voter voice is great. It gives you standard language. You can add a personal message and you can send it right from there. So it's easy. It's a link you could put on your own website and direct your patients to go to your website and then click on the link so that they can voice their support as well. Because this is what it's going to take, everybody. It is going to take a lot of grassroots, a lot of patients sending in messages, a lot of providers, staff, everybody. Create handouts. Go to Cairo Congress if you want more information from them as well. It's going to be a really monumental effort of grassroots to do this.
Absolutely. And this is the way we got chiropractic in every state. Is through our patients. It's not common sense. It's not politics. We as a profession don't even have close to enough money to influence the lobbyists in ways to make a difference. This is how it's done. You send in your request. You get your patients to send in a request. One call to a politician's office, they look at as the equivalent of 11 calls. So you get 100 of your patients to sign one of these pieces of paper. To them, that's 1,100 voters in their district that they care about. So this is the call to action, not just for you. Don't just fill this out for yourself. Have it in your office. Fill it out for everybody. Everybody in your office should be handed the ability to get to this link and do this, whether they're Medicare or not. Because sooner or later, God willing, we all hit Medicare age, right?
Don't you think one of the best times to
See, I
ask a
gave you that one,
patient
and you just let that one go.
well,
That's good.
because
Yeah,
I have important things to say, of course.
yeah.
But to me, I think the best time to ask your patient to click on the link or direct them is when you're asking that Medicare patient to pay for the exam or the non-covered service, is to
Yeah.
say, "Oh, by the way, if you're sick
You
of
don't
paying
like
this,
this? Yeah, you
yeah,
don't like this?
yeah, here's a link to change
Yeah,
that."
I
So,
have a solution. Well, it was the same thing we used to say
yeah,
about when they complained about maintenance care not being covered. We said, here's the maintenance care definition and your senator and
yeah,
representative on the bottom. Because to
yeah,
change this, as we're saying to you now, to change anything in Medicare requires an act of Congress.
yeah. So, I'm not
Do
telling
it.
you what to do out there, doc, but I'm just saying your front
I
desk rep
am. Do it.
yeah, it would be really like, that would be the time. Maybe have
Oh,
a
that time.
terminal, maybe have a computer up in your office with the website, they can just put in their stuff and send it
There
right
you
from
go.
there,
I like
like
that idea too. High
yeah,
tech. High
or
tech.
tablets. I mean, they're Medicare patients, it might be a little challenging, but you can
Yeah.
help them through it. So
Yep.
just saying.
Call
So,
to action, baby.
and what we really didn't emphasize, which is interesting, is that the reimbursement is based on your scope of practice in your state. And
Mhm.
so before we started this episode, Dr. Davini and I were talking, and you had mentioned something like, well, some states cover acupuncture for chiropractors, right? And so in some states, there's the potential that Medicare would cover the acupuncture services if, in fact, this language, gets passed as is. What I find very interesting is that there's a newer question in PICOS on the Medicare application that was introduced. I think it was either a year or so ago. And when you revalidate, you have to go in and answer this question. It's whether or not you perform acupuncture services legally in your scope of practice in your state. That application
Mm,
question exists right now. Is that foreshadowing or
interesting.
not?
Yeah,
That
interesting.
foreshadowing about this bill? I think it might be because
Mhm.
when members ask and we do this revalidation assistance with them, I always have to go in and answer that question because if they haven't, validated in, 3 to 5 years, that question wasn't there. Now it is.
Right. Now it is. So what's that say? They know.
Yeah, maybe there's,
They
like I
know.
said, maybe there's a foreshadowing of this thing actually passing at some point,
Yeah.
which would be amazing, you
So
know?
do it. Get out there. Get these cards and letters going to your state senators and representatives. This is important.
It is. So allthingschiropractic.com. Head over there. Below the player of episodes, you'll see the two links to the tracking and the text, as well as the link to share with your staff and patients so that you and they can submit their letter of support or message of support, which is valuable. That's what's going to do it right there.
Perfect.
Nothing else at
Perfect.
this point.
Yeah.
All right. Well, thanks again for joining us for another episode of All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini. Right on!
I'm so sorry, everyone.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.